there, and welcome to this week's edition of Wilson Post in Motion. I'm Becky Andrews, and today we are here with board-certified plastic surgeon Dr. Dwayne Lett, who is with the Lett Center in Wilson County, Wilson County's only board-certified plastic surgeon, and he is here today going to tell us a little bit about Botox and fillers. It seems like everybody my age and younger, a little bit older, they all want to know about this because it's supposed to be this magic potion that makes women look not as tired. And we also have a model. Let me introduce you to. This is Renee Crecilius, and Renee is 25?
Yes.
Yes. She's 25. I'm kidding. Do you mind if I tell them how old you are? Renee is 40 years old, and she doesn't look it. She has graciously volunteered to be our model today. Dr. Lett, tell us a little bit about what you're going to be doing today to Renee.
So we're going to do some procedures that are very simple and have very little morbidity. In other words, the patient can have this treatment during the lunch break or after work, and there will be very little visible difference in the appearance as far as bruising or swelling, but the patient can look rejuvenated. So it's almost like a maintenance type procedure in order to allow a person to look refreshed, youthful, and more alert. This product is very useful in patients who are just beginning to show signs of aging. Usually in the mid-30s, about 35 in most women, they'll start to exhibit a little bit of dark hollowing underneath the eyelid or underneath the eye, some crow's feet, and maybe some people are familiar with this thing called the 11, and it's a result of just early wrinkling and loss of volume. So part of what happens as we reach the age of 35 or so is that our body physiologically shifts tissue around. So some of the volume that was in our face moves to other parts of the body, and so our face can look hollow. This deflation causes us to look even more sort of wrinkled, aged, and tired. Some people below the zygoma have this hollowing that can occur here, and it looks deflated. So a person can look almost too thin. And then below the lower lip, sometimes will look a little deflated or empty or dark in this area here, and it's because the volume has just moved elsewhere. Patients will also complain of wrinkling here or large crevice here. This nasolabial fold is really a result of this tissue drooping down here. So what we're going to do is try to do a liquid facelift in the office with minimal downtime, minimal bruising, and get an effective result. So a treatment can be modified to sort of fit a patient's budget. Facelifts can range somewhere between $5,000 and $20,000 depending on the procedure that is being included in the facelift. And it can require not just local anesthetic, 2 to 3 hours of surgery in the office, or 4 to 6 in an operating room. I think it's always important to ask an operator their experience, the number of cases they've done, types of complications they've experienced, and the treatments that they recommend when those complications have occurred. You want to just make sure you have a connection with that person, that you trust them, that you feel like that they have your best interests in mind and you're not just another number. So we're looking at temporal hollowing has been corrected in this site here. Some of the depression over this bone here is made more uniform here. The cheek is more full, and the nasolabial fold is flattened here and less visible than it is on the other side.
Well, thank you so much, Dr. Lett. And again, you have offices in Lebanon and Mount Juliet, your new office, which is beautiful, across from Providence Marketplace. So you're open Monday through Friday, some Saturdays?
That's correct.
Okay, great. And if you need more information on Dr. Lett's office, you can visit our website, wilsonpost.com, click on the In Motion tab. For now, we're going to get out of here. Thank you so much for joining us. We'll see you next week. We're going to stay at the Lett Center and talk to Christy Lett, who is the licensed esthetician here at the Lett Center. Thank you so much for joining us.